Some of the symptoms of depression are loss of pleasure in things I normally enjoy. It would also look like I might talk a little bit more slowly than I typically would. I might have more difficulty concentrating or focusing. Some other symptoms are I might feel particularly sad, and that might stay that way for a period of time. Some depression is episodic, so it might be my depression comes back again and again. I also might have sleep problems. I also might have some relationship issues as well. So depression is pretty common. However, when it becomes a problem is if it impairs my functioning. So if I have difficulty doing daily activities like personal hygiene issues, making sure I'm going to work, if it might lead me to some problematic behaviors like drinking for long periods of time, that's when depression becomes an issue, and that we might need to look at that. So what we do at Salt Lake Behavioral Health is that we look to have a whole person perspective on mental health. So that means that we're going to look at medications and what's worked, what hasn't worked, what can we try that could work. We also want to look at this person's background. Are there some triggers for them? What are their warning signs? How much social support do they have? Do they have somebody in their life who they can talk to about things, who they can feel close to and give a call when they're really feeling down? So we also want to look at what their social support is, because what we know is that people who have social support do better, not just with depression, but have a better overall well-being. We also look at involving family in this. And it can be an opportunity for the client to express to their family, this is what you can do to support me. And we also can provide some family education about the symptoms of depression, what treatments work, and also some recommendations moving forward. So we do group therapy and on the unit, but we also provide weekly individual therapy for clients too. Provide individual therapy, and often that looks like challenging old beliefs that don't work anymore. It might also look like finding new thoughts to replace old thoughts with, and also how can we provide them with a plan of if they get that low again, what can they do? So one of the things that we do for clients is we want to make sure that when they leave the hospital, they have aftercare appointments set up. And that might look like a referral to our IOP program. It might look like them following up with their current provider and making sure that they're in contact with them. So we want to make sure that when a client leaves us, they've got treatment set up. One of the things that I've seen at this hospital is a lot of people rebuild their lives in a very different way. And that's been very gratifying to see.